This presentation focuses on recommendations for reporting on suicide from the Suicide Prevention Council of Washington County, Oregon. Our objective, as always, is that by working together through awareness, promotion, and education, we can reduce the incidences of suicides and prevent individuals from becoming suicidal. Towards the end of the presentation, we'll look at a list of warning signs for suicide which might be helpful to include in any article that you might prepare. We will also take a look at local media coverage of suicides over the last couple of years here in Oregon, and we'll focus on some of those articles from some of the major media outlets in the Portland metropolitan area. Research studies from around the world have clearly shown that news coverage can increase the likelihood of suicide in vulnerable individuals, which is why these recommendations are so important, because we want to decrease the likelihood of suicide in vulnerable individuals. But the increase is related to the amount, duration, and prominence of the coverage. It's kind of astounding to think that additional suicides increase when the story explicitly describes the suicide method, uses dramatic headlines or images, and repeated extensive coverage sensationalizes or glamorizes of a death. So these studies have shown that covering suicide carefully, even briefly, can change public misperceptions and correct myths. And this is very important because we want to encourage those who are vulnerable or at risk to seek help. So media and online coverage of suicide should be informed by using best practices. Some suicide deaths may be newsworthy. However, the way media covers suicide can influence behavior negatively by contributing to contagion or copycat, or positively by encouraging help seeking. Suicide contagion or copycat suicide occurs when one or more suicides are reported in a way that contributes to another suicide. This is a tragic story here about Bridgend County in Wales in around 2009. And you see from some of the media coverage here, dozens of teenage youths in this Welsh county borough of Bridgend killed themselves. And it talks here about a media frenzy, that Bridgend was portrayed as a dark and depressing place. And as the coverage intensified, so did the deaths. So this is what we see around the world, the studies that have been done around the world, that how we cover the suicide, how the media covers suicide is really, really critical and can play a real critical role, either negatively or positively. So we want to make some recommendations here, again, as to how we'd phrase some of these issues. So we can see big or sensational headlines or prominent placement. It would be better to inform the audience without sensationalizing the suicide and minimizing prominence. And we give some examples here about what that looks like. And instead of including photos and videos of the location or method of the death, which we've seen here in Wales. So instead of that, use schoolwork or family photos, include hotline logos or local crisis phone numbers. And we can see here at the bottom, in reference, additional information can be found at reportingonsuicide.org. And here's a report from one of our local media stations in Portland, KATU, and it talks about a young man who tried to take his own life, and he puts this down to cyberbullying. But you can see here from the article that KATU did not share how Marcus tried to take his own life. And the report also talks about speaking to suicide experts that they spoke to on the subject, which we highlight in this presentation. And it also speaks to Marcus, this young man here, getting help, and a lot of hope in the actual report here as well from Marcus to other people who might have been thinking about trying to kill themselves. Instead of describing recent suicides as an epidemic or skyrocketing or other strong terms, it'd be better to carefully investigate the most recent CDC data and use non-sensational words like rise or higher. The CDC data can be accessed from the website, the Center for Disease Control and Prevention. This website has lots of data relating to these issues. Describing a suicide as inexplicable or without warning. Studies have clearly shown people who die by suicide exhibit warning signs. So to include the warning signs and what to do in your article if possible. There is a slide here at the end of the presentation that includes warning signs and what to do if somebody exhibits these warning signs. John Doe left a suicide note saying, "Would it be better if we would look at a note from the deceased was found and is being reviewed by the medical examiner." This story here from another major media outlet in Portland, KGW, does go into a little bit of detail about the gunshot wound to the head. But you can see also here at the bottom that it talks about those struggling with suicide thoughts or mental health crisis to call, give them a number to call for help. Some more suggestions. Investigating and reporting on suicide similar to reporting on crimes. It's probably better to report on a suicide as a public health issue. Kind of change the whole focus around. Quoting interviewing police or first responders about the cause of the suicide. Might be better to seek advice from a suicide prevention expert. And referring to suicide as successful, unsuccessful, or a failed attempt, described as die by suicide or completed or killed him or herself. So with these recommendations to the media here, we want to avoid misinformation, and it's critical that we offer hope. Hope is what we really want to offer to people who are in this situation. And there are always many multiple causes, including psychiatric illnesses that may not have been recognized or treated. However, these illnesses we know from studies are treatable. So suicide is a complex issue. I want to refer to research findings that mental disorders and substance abuse have been found in 90% of people who have died by suicide. So we want to avoid reporting that death by suicide was preceded by a single event, such as a recent job, divorce, or bad grades. Reporting like this is shown that it leaves the public with an oversimplistic and misleading understanding of suicide. And we want to avoid putting expert opinions in a sensationalistic context. So consider quoting a suicide prevention expert on causes and treatments. Use your story to inform readers about the causes of suicide, its warning signs, trends in rates, and recent treatment advances. And again, bring hope with statements about the many treatment options available. Stories of those who overcame a suicide will bring lots of hope, and of course include up-to-date local resources where readers or viewers can find treatment information and advice that promotes resources for help seeking. In this section, we wanted to cover suggestions for online media, message boards, bloggers, and citizen journalists. Studies have shown that public commentators can help reduce risk of contagion, copycat, with posts or links to treatment services, warning signs, and suicide hotlines. We keep emphasizing that stories about hope and recovery, information on how to overcome suicidal thinking, and increase coping skills. These are very, very important. Again, we want to bring hope to people who have, who are dealing with hopelessness. So we see it vital that online coverage of suicide follows sites or industry safety recommendations. Studies have also shown that social networking sites often become memorials to the deceased and should be monitored for hurtful comments and for statements that others are considering suicide. We suggest message board guidelines, policies, and procedures that could support removal of inappropriate and or insensitive posts. And here's a list of warning signs that we talked about before, which if you're doing any kind of report, it'd be good to list these or some of these. Experts believe that most suicidal individuals do not want to die. They just want to end the pain that they're experiencing. Experts also know that suicide crisis tends to be brief. When suicidal behaviors are detected early, lives can definitely be saved. So it would be good for the public to recognize these warning signs so that we can help people and save lives. So talking about wanting to die, looking for a way to kill oneself, talking about feeling trapped or in unbearable pain, talking about being a burden to others, increased use of alcohol or drugs, acting anxious, reckless, sleeping too little or too much, withdrawal or feeling isolated, showing rage or talking about seeking revenge, displaying extreme mood swings. The more of these signs a person shows, the greater the risk. Warning signs are associated with suicide but may not be what causes a suicide. If someone you know exhibits warning signs of suicide, here's what to do. Do not leave the person alone. Make sure you remove any firearms, alcohol, drugs, or sharp objects that could be used in a suicide attempt. Take the person to an emergency room or seek help from a medical or mental health professional. And here is a National Suicide Prevention Lifeline at 800-273-8255. And this concludes our presentation. Thank you.